Your heart disease dog is panting in summer, and the most important clue may be whether the breathing follows the room.
That sounds simple, but it can stop you from guessing. In a minute, we'll get to the one count that turns a scary moment into something you can actually track.
Good, because my first instinct is panic watch mode.
Then start with the environment. Move your dog somewhere cool and quiet, let the air conditioning bring the temperature down, and don't judge from the first noisy minute.
So the test is change the room, then watch the breathing.
Yes, heat and nervousness are like a hand pressing a doorbell. Once the room cools and the moment gets quieter, that hand should come off the button. If those were the main triggers, the panting should ease.
And if it doesn't ease, that's the part that matters.
Right, panting that still doesn't improve after cooling is different from it's warm today. For a dog with heart disease, blaming the weather and stopping there is the risky shortcut.
I get that, but the tongue color check has always felt a little vague to me.
Fair. You're looking for a tongue that's nice and pink. If it looks pale, darker, or purple toned, that's a warning sign and a reason to check with your vet.
Here's my pushback. Color can be subjective. I might talk myself into normal because I want it to be normal.
That's a real problem, and it's why you don't rely on color alone. Think of the tongue like a dashboard light. Useful, quick, but not the whole diagnosis. Pair it with the breathing count.
That's the loop you opened the count that makes this trackable.
Exactly. When your dog is asleep, count breaths for 1 full minute and write it down. Sleeping breathing should be within 30 breaths per minute.
Asleep, not just lying there annoyed at me.
Asleep. A sleeping count is like weighing yourself on the same scale each morning. It removes some of the noise from heat, nerves, and activity, so changes are easier to spot.
And this is not about one random weird moment.
Correct. For dogs with heart disease, changes in respiratory rate are something to watch every day. The point is catching a pattern that's different from your dog's usual.
So, cool room, pink tongue, 1 minute sleeping count, written down.
Yes, cool, look, count, record. It's like leaving breadcrumbs for your vet. So you're not just saying something feels off. You can say, what changed?
I'll say the tempting thing though. If my dog already has heart meds, bad breathing makes me want to adjust them.
Don't adjust heart medications on your own. Use the signs to decide when to call your vet, not to change treatment by yourself.
So when do I call?
Call if the tongue looks pale, dark, or purple toned. Call if panting stays abnormal after cooling and quiet. And call if your dog seems clearly worse.
Tight version. If the breathing doesn't follow the room, don't shrug it off.
Cool. Look, count, record, then act early when the pattern changes. Next, the breathing count mistake that can make a calm dog look scarier than they are.